Infections. A. Fever. A medical student has made some language notes on a case report. Case 45. A 24-year-old man presented with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history or relevance was hepatitis 4 years earlier and glandular fever, infection with Epstein-Barr virus. At the age of 8 years, he had returned from Africa 3 weeks previously. Fever, pyrexia, also remember PUO, pyrexia of unknown origin. Fever, also known as temperature. If got a temperature. Adjective, feverish, feverish, febrile, and pyrexia, opposites, febrile, pyrexia. Some symptoms of fever: sweating, rigors, severe shivering, and sensation of coldness, also known as chills. B. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, such as viruses or bacteria, that can usually be identified, thus establish the etiology early in the illness. Many of these organisms include all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many known infections, degenerative and chronic diseases. Communicability is another factor which differentiates infections from non-infectious diseases. Transmission of pathogenic organisms to other people, directly or indirectly, may lead an outbreak or epidemic. Finally, many infections are preventable by hygienic measures by vaccines, especially live attenuated vaccines such as rubella vaccine, or by drugs prophylaxis, for example, chloroquine to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite and causes malaria. Another general words for these pathogens is microbes. Patients often refer to microbes as germs and bugs. Notice the common expression for acquiring an infectious diseases. Could he have caught some diseases from the dog? Could he have picked up some diseases from the dog? I think if caught the flu bug, a bug, that's going wrong. C. Source and spread of infection. Here is an extract from a medical textbook. Infection may originate from the patient endogenous, usually from skin, mesopharynx, or bowel, or from outside source, exogenous, often another person who may be either suffering from an infection or carrying pathogenic microorganisms. Carriers are usually healthy and may harbor the organisms in the throat, for example, diphtheria, bowel salmonella, or blood hepatitis, hepatitis B, or HIV. Non-human source of infection include water, cholera, milk, tuberculosis, food, botulism, animals, rabies, birth, cirrhosis, and also the soil, Legionnaires diseases. The incubation period is the period between the invasion of the tissue by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others.